I'm Julie Nelson, Executive Director of Elmhurst Outpatient Surgery Center. Elmhurst Outpatient Surgery Center is a multi-specialty ASC in the Chicagoland suburbs, and we have been providing outpatient surgical care since 1999. So we are a joint venture of Elmhurst Hospital and our physicians. We perform over 8,000 procedures annually, and really over the past 5 years, we have transitioned to a much higher patient acuity of cochlear implants, spine procedures, and total knees. So really have been providing the whole spectrum of care for pediatrics through the geriatric patient population. As a healthcare provider, you have a sense of, if you work at a quality organization, if you or your family would have surgery at your center. And I can say that I personally have had surgery at our surgery center, and so have our staff and our physicians. We're excited to participate in Leapfrog because for the first time, it provided us an objective documentation of the quality of care that's provided. So we were able to transition from a subjective assessment that our care is excellent to an objective documentation of quality of care that's provided. We really believe that not only is transparency of quality of care important for our patients, but really, I believe that we have a responsibility for our ASC community to document the quality of care that's being provided. Right. You know, the frontline staff are really critical in identifying areas for improvement, whether it is in clinical quality or patient experience. And about 3 years ago, we took our first culture of safety survey. And that really gave us a more formal opportunity to assess how staff feel about quality at our organization. And what we received from that was feedback that staff wanted a more formal role in our committee structure. We have a very robust committee structure of clinical leadership, physician leadership, reporting up to the board, but the staff really wanted to have their own patient safety committee where they could more formally provide feedback and requests. And we implemented that about 2 years ago, and that has really been fantastic in giving our staff a role at the table. We also participate in SPH analytics for patient satisfaction, and that has given our patients a voice. We mostly get acknowledgement of the care that they receive, but if there was an opportunity that we missed, it also gives us an opportunity to hear from the patients what they would like improved. So it's been very helpful to us. The Leapfrog Top ASC Award really has been greatly received by our staff, by our physicians, as an acknowledgement of the excellent care that's been provided here and the focus on continual process improvement. It was really, besides patient satisfaction, it was really that first, as I said before, subjective documentation of the quality of care that's provided. But, you know, not only does it acknowledge all of the work that's happening, I really feel that the Leapfrog survey is bringing ASC care to the next generation of service. It's really educating our patients in regards to where they are receiving care. And I really encourage my fellow ASC leaders to participate in the ASC Leapfrog survey. just because we know that we're providing such great quality of care, and it provides an opportunity to sit at the table and represent outpatient surgical care at its finest. And I really do believe that if you are participating in this, you are really fostering the growth and development of our community, of our services. So I certainly will be talking with some of my fellow ASC leaders, and would be happy to answer any questions in regards to what it takes to participate. When we first started, we were on paper charting, so that is not a barrier for participating. We are since, electronic, but I urge you that if you are going to invest in anything, invest in documenting the quality of your care. It is much more, our patients are much more educated, and they really deserve to know the care that's being provided at their center. So thank you.